So now we come to the physical causes of fatigue. So liver disease, kidney disease, heart disease, lung disease, diabetes, neuromuscular like multiple sclerosis, cancer. These are all very serious, but with a good history in physical and an EKG and maybe a chest x-ray and some other tests, most physicians can rule these things out. How many of you have been to a doctor complaining of fatigue? They do all the regular, normal blood tests, and they tell you there's nothing wrong. Okay, right. So what we concentrate more is the second half of this. Thyroid, huge. Hypothyroidism causing fatigue. Many people are not diagnosed. They're underdiagnosed for thyroid disease. Sleep apnea, very common. Restless leg syndrome, where you're moving your legs at night and it's waking you up. Lyme disease and co-infections of Lyme. Epstein-Barr virus, which is the mononucleosis. You can have chronic Epstein-Barr. And there's also one called, which I'll go into, called HHV6, which is human herpes virus 6. Medications I mentioned, and chronic fatigue, which is, the name is changing to myalgia encephalomyelitis. And in Europe and Canada, this is what chronic fatigue syndrome is called. It's much more descriptive, and there's going to be better funding if we change the name. So let's start with thyroids. The thyroid gland is a small butterfly-shaped gland in the neck. 27 million Americans have thyroid disease, and 13 million are undiagnosed. Women are 8 times more likely than men to have thyroid disease. We have hyperthyroidism, which can cause an overproduction of thyroid hormone, a hypermetabolic state. These people are agitated, irritable, weight loss, diarrhea, sweating, very uncomfortable. Hypothyroid is more the fatigue, the hypometabolic state. The labs that I like to do if I'm ruling out hypothyroidism or anybody who has fatigue are the following. Yet most physicians will just check one test, the thyroid stimulating hormone, TSH. That's produced in the pituitary gland. It stimulates the thyroid to make thyroid hormone. But we really want to know what the free T3 and the free T4, these are the circulating thyroid hormones. Reverse T3 tells us whether you're producing enough T3. We have more T3 receptors in our body. That's the most stimulating thyroid. And then also looking at thyroid antibodies to see if we have an autoimmune disorder that's attacking the thyroid is important. So hypothyroidism can come with family history of autoimmune disorders. Pregnancy can induce hypothyroidism. Drugs like lithium can induce hypothyroidism. Radiation to the head and neck can destroy the thyroid. Cigarette smoking. And there are areas in the world where there's a lack of iodine in the soil. Places where glaciers are covering the soil. So there's a true lack of iodine. These are called goiter belts. And these people have large thyroids and they're hypothyroid. In this area, we don't see that much low iodine. The salt is iodinized, although a lot of people are using sea salt, so we're not using table salt. So, but if you eat Japanese food, you're getting iodine. So there are some, I do pick up some people with low iodine, but in general, this area doesn't have a lack. Symptoms of hypothyroidism include fatigue, weight gain, constipation, depression, low sex drive, brain fog, pain, hair loss, and infertility. The treatment includes thyroid medications. So many doctors will only give something called levothyroxine. And this is a T4 medication with the assumption that the body will just convert it to T3 and everything will be fine. And then they don't check T3. So, but there are conditions where the T4 is not converted to T3 and we have a relative T3 deficiency. So I do see patients that come in, are on their T4 supplementation, their numbers look okay, their TSH looks okay, but they're still exhausted. I check their T3 and it's suboptimal. So I prefer, and most of my patients prefer, taking a thyroid hormone that includes both T3 and T4, such as Armour thyroid, Nature thyroid. These are from pig thyroid. Or we can add T3, something called Cytomel, to what they're taking, their T4 supplementation. In addition, we need to know what the adrenals are doing, because if they have that adrenal fatigue picture, then you can give them all the thyroid you want, but nothing's going to happen until you fix those adrenals. And sometimes they also need thyroid support. They may need iodine, zinc, selenium, and tyrosine. So we're moving on to sleep. Sleep disorder. This is the Epworth Sleepiness Scale, and this scale, if more than 10, tells us that you have a high risk of sleep apnea. The questions are rated from 0 to 3, chance of dozing off. Do you doze off while sitting and reading, watching television, sitting inactive in a public place like a meeting or theater, as a passenger in a car for an hour without a break, lying down to rest in the afternoon, sitting and talking to someone? Now it gets more serious. Sitting quietly after lunch when you've had no alcohol, or in a car while stopped at a traffic light. And I've had some patients that have fallen asleep at the wheel because of sleep apnea, some serious accidents or potential accidents. So this is very, very serious. This is an example of part of a sleep study. We do a home sleep study test, and this is just part of it. I just want to point out what we look at besides sleep time. We look at something called respiratory distress index and apnea-hypopnea index. This should be under 5. Between 5 and 15 is mild to moderate sleep apnea. Over 15 is severe. This individual had an apnea-hypopnea index of 39 and respiratory distress of 40. He also had an oxygenation level that dropped to 72%. Your oxygen should be staying in the high 90s all the time when you're sleeping, all the time. And this individual had 118 events where their oxygenation level dropped at least 4 to 9%. 62 events were dropped at least 10 to 20%, and 3 events were dropped more than 20%. So this is considered severe sleep apnea. Continuous positive airway pressure, CPAP, is indicated in this case. Now, Dr. Gary Kaplan did a lecture a few months ago on chronic fatigue, myalgia, and encephalomyelitis. So for further information, you can check our website. We tape all our lectures, and they're all on our website. We have a great library of lectures. So chronic fatigue, as I mentioned, that in Europe and Canada, it's called myalgia, encephalomyelitis, muscle pain, and brain and spinal cord inflammation. It's also been called systemic exertional intolerance disease. So the symptoms include post-exertional malaise. So when these people exercise or exert themselves, they are very exhausted. And one of the following: cognitive impairment, pain, sleep disturbance, and balance issues. They usually also have immune dysfunction, digestive issues, food and chemical sensitivities. So we'll call it CFS-ME. If anyone's read Dr. Gary Kaplan's book, Total Recovery, you'll know about his research regarding microglia. So microglia are small cells in the brain that are part of the immune system. And they eat up dead bacteria and viruses and dead neurons, so they keep the nervous system clean. However, if we have one of these situations, or multiple, actually it's usually more than one of these situations, the microglia can be upregulated. And then what happens is the microglia excrete an inflammatory factor. This causes brain inflammation. So this is a neuroinflammatory condition. So what are some of the things that can cause this microglia activation? Hypoxia, the most common, is sleep apnea. Physical trauma like concussions, major surgery, car accidents, psychological trauma, infections, which we'll go over, Lyme and Epstein-Barr and some other types of infections. Celiac. So 1% of the population has celiac disease, and at least 6% have gluten intolerance. We'll talk about that. Environmental exposures like mold exposure, mycotoxins, or other types of exposures, including lead and mercury, heavy metals. So what about digestion? We mentioned celiac. There's other foods besides gluten that can cause digestive problems, like some people react to dairy, corn, soy, and there's ways we can actually test for these. But gluten is at the top of the list as far as causing what's called leaky gut. So what leaky gut is, what happens in the small intestine is the cells that should be tightly bound to each other gap because there's inflammation. And then large proteins and toxins are absorbed through the digestive tract into the bloodstream. In addition, the cells themselves in the small intestine aren't working properly, so we don't get absorption of our nutrients. So it becomes a malnutrition and malabsorption situation. And this can lead to anemia, which can lead to fatigue, as well as B12 deficiency and magnesium deficiency, just to name a few of the malnutrition, the consequence of malnutrition. And how about infections? What kind of infections can contribute to fatigue? So we know about Lyme, but these are some of the other tick-borne diseases, ehrlichiosis, Bartonella, babesiosis. And they can be in the tick at the same time that you get infected with Lyme, that you could also be infected with one of these other tick-borne diseases. Now, Epstein-Barr virus is a mononucleosis, but you can have chronic Epstein-Barr. And I mentioned HHV6, which is human herpes virus 6. There is a doctor at Stanford, Jose Montoya, who treats chronic fatigue patients. He screens them for Epstein-Barr and HHV6 specific testing that he does, and in a select group, if they have high enough titers, he uses an antiviral medication called Valicite. So we actually do test often for our patients with fatigue and use the Montoya protocol in select patients.